Multiple myeloma maintenance is something that's all cancers these days, most cancers these days, they're toying with the idea of maintenance therapy. And, I know breast cancer patients that are on maintenance therapy and others. So it's a new theory, and like a lot of new theories, it makes sense, but it still hasn't been proven to be true, and some that make sense are proven to be untrue. But with multiple myeloma, because it tends to come back, any of the big facilities and myeloma specialists are working with something called maintenance therapy post-treatment. And sometimes it's just Revlimid, sometimes it's just Velcade, sometimes it's a combination of several different drugs. If they're high risk, they might have, melphalan added to it. But out of Arkansas, where we treated, it's a standard Revlimid, Velcade, and dexamethasone. Dex being the steroid, which supposedly helps to increase the efficacy of that. The Velcade infusion is weekly, and the Revlimid is either a 21 or 28 day cycle, and it typically depends on how well you tolerate it, which of those 21 to 28 day cycles that you're on. Some people's red blood count gets severely suppressed, and so there have to be adjustments made, breaks, and so on and so forth. We had to go off the dexamethasone because my husband had used it pre-treatment, at the initial onset of diagnosis, and he began to build up what they called a toxicity, and he had severe edema, and it became more of a quality of life issue. But it's a double-edged sword because we were certainly thrilled to get off the dexamethasone, but then we do that knowing that the efficacy of the other two drugs are lessened by not including dexamethasone. So maintenance therapy is something that is difficult because it continues the side effects of peripheral neuropathy, fatigue, interfering with your life, not to mention the psychological part of reminding you on a daily basis that you have cancer.
Laura, I have a question for you. Can you clarify the Revlimid, Dex, Velcade maintenance numbers? Because that's a pretty, RVD is a standard treatment to get when you're first diagnosed with myeloma. I presume the dosages under maintenance are lower than the normal doses you would be getting when you were first diagnosed. What are the doses he was going to be getting?
I'm not sure what his dose of the Velcade is, but I would agree with you. It is more of sort of a little drip, drip, drip of the chemotherapy. The Revlimid is 15 milligrams over 21 days. He started out with
the normal of 25.
Right. And he originally started with 10 over 28, but he tolerated it, so they upped it and then gave him the week off with the 21-day version. And in Little Rock, the protocol goal is a 3-year maintenance. And some go off maintenance very early because the side effects just impact their quality of life so dramatically that they just, and then, but the dirty little secret is they will want him on that regimen as long as his insurance will pay for it and as long as he can tolerate it.